It was a long weekend. David was driving to hometown from his workplace. He met with an accident. Car flipped and the door was jammed, so it took a while to escape the car. He was injured and got admitted in hospital. He recovered from physical injuries, but David finds it difficult to concentrate on his activities. Every time he hears brake sounds, screeching in the nearby road, he remembers the accident and developed hypervigilance. He avoided driving. David had developed ASD, that is Acute Stress Disorder. In the weeks after a traumatic event, a person may develop an anxiety disorder called acute stress disorder. It typically occurs within 1 month of a traumatic event. When it occurs, it lasts at least 3 days and can persist for up to 1 month. Types: acute dissociative reaction. This is when you have a lot of confusion and feel like you are not in control of your body or thoughts. You may also feel numb or detached from what is happening around you. Acute traumatic stress reaction. This is when you have a lot of fear, anxiety, and shock following the traumatic event. You may also feel like you are in danger and have nightmares or flashbacks about the event. Acute grief reaction. This is when you experience a great deal of sadness and anger after a traumatic event. You may also have trouble sleeping and notice that you are not interested in your normal activities. Symptoms. The symptoms of acute stress disorder fall into categories of intrusion, negative mood, dissociation, avoidance, and arousal. Intrusion symptoms. It is recurrent, involuntary, and distressing memories of the traumatic event. Recurring nightmares related to the event. Flashbacks, intense distress, or bodily reactions to reminders of the event. Negative mood. Ongoing negative mood and inability to experience positive emotions. Dissociation. Altered sense of surroundings such as feeling dazed or slowing of time, amnesia, or inability to recall important details of the event. Avoidance. Avoidance of upsetting memories and thoughts associated with the event. Avoidance of people, places, or situations that bring memories of the event. Arousal. Difficulty sleeping, irritability and aggression, hypervigilance or feeling on high alert, difficulty concentrating, heightened startled response. Causes. Acute stress disorder is caused by exposure to trauma, which is defined as a stressor that causes intense fear and usually involves threats to life or serious injury to oneself or others. Examples are rape, robbery, warfare, natural disaster, etc. Genetic causes. There is a strong link between certain genetic components and ASD symptoms and typical responses after a traumatic event. Environmental. Certain environmental factors increase the likelihood of developing ASD, such as the coping strategies of worrying and punishment and having a poor support network, whereas other environmental factors can reduce the likelihood of developing ASD, such as a good family cohesion and expressiveness and the ability to manage post-traumatic recovery. Diagnosis. Physical diagnosis. It is important to rule out other causes such as drug abuse, side effects of medications, health problems, other illness, etc. Psychological. Mental health care provider will diagnose ASD by asking questions about traumatic event and the symptoms. It is important to note that the symptoms must last for between 3 days to 4 weeks. These must also first show within 4 weeks of the event that traumatized the person. Management. Treatment for acute stress disorder typically involves the use of medication and psychotherapy. Psychotherapy. Cognitive behavioral therapy is one of the most common forms of psychotherapy used for people with acute stress disorder. With CBT, you are taught to deal with the effects of the traumatic event and how to avoid your trigger. Additional type of effective psychotherapy include cognitive processing therapy and prolonged exposure. Medication. The use of medication is not typically the first line of treatment considered when treating acute stress disorder. However, in some severe cases, it might be used alongside the psychotherapy. Other tips to help you cope with this condition, that is, don't neglect your physical health. Remember to eat a balanced diet, exercise regularly, and get enough sleep. Then surround yourself with family and loved ones. It is essential to feel safe after a traumatic event has occurred. Hope you like this video. Please subscribe the channel for more videos on related topic. Thank you. Keep smiling.